Hello everyone, in this video we're going to talk about the surface and regional anatomy that makes up the abdomen. We'll be talking about abdominal anatomy and I will try to include as many clinically interesting things as possible. So let's start by first talking about what constitutes the abdomen. At the most basic level, the abdomen forms part of the trunk and is inferior or below the thorax. You have an abdominal cavity, which you can see on the picture on the left, which is bound superiorly by the diaphragm, this muscle right here, and inferiorly by the pelvic inlet, which is just a fancy word to say the opening towards the pelvis, or the first part of the pelvis. So you have this pelvic cavity right below the abdominal cavity, and the abdominal cavity and pelvic cavity are technically continuous. You just have the pelvic inlet to kind of have some sort of division between the two so that it can be easier to categorize this anatomy. On the outside, we have the abdominal muscles, which include the rectus abdominis, or more commonly known as the six-pack muscles, and the obliques, protecting the inside of the abdominal cavity. So all those organs that you can see over here. What's really cool about the abdominal cavity is that because it's bound by the diaphragm, it means that its size can change with your pattern of respiration. So as we know, the diaphragm can move depending on how you're breathing. And so your abdominal cavity can go as high up as your fourth intercostal space. So remember that the fourth intercostal space is the space between the fourth and the fifth rib. So if we count over here, 1, 2, 3, it can go as high up as the fourth, as you can see in this picture. So the size of the abdominal cavity can vary a lot. Now, you may be wondering why knowing the surface anatomy of the abdomen is relevant. And clinically speaking, it can provide you a lot of information if you can determine where someone's pain is located, or for instance, what organs and vessels you need to worry about in some specific injuries. For example, let's say you have a patient who had a penetrating trauma in the left upper quadrant. This can be worrisome because you can have damage to the spleen, which is in that quadrant. And if there's damage to the spleen so that it can rupture, you have a high risk of hemorrhage, and the patient can bleed out and die. Another example regarding the spleen, in people who have mononucleosis, their spleen will swell up. And so that's why they're advised to avoid any contact sports for a couple weeks because of that risk of splenic rupture. So I'll provide more clinical examples like this one as I talk more about this anatomical region. So now let's move on to the different ways in which we can divide or split the abdomen. So I've set it up here so that we have two of the same pictures. And what I'm going to do is show you the two most common ways in which the abdomen is divided. So there is a simple 4-quadrant pattern and also a 9-region pattern. And these different quadrants and regions can be easily divided and identified if you know the planes that transect them. So let's go over that. Let's start with the 4-quadrant pattern. So we're going to zoom in over here and we have our left picture. So this is going to be our 4-quadrant pattern. In order to have 4 quadrants, you need 2 planes. So we're going to have a vertical plane and a horizontal plane. Starting with the vertical plane, this is simply a continuation of the median plane. So if you think of the body's median plane, you just want to think of a line that divides your body into right and left. So if we just continue that, this will divide our abdomen into a right and a left section. So the way we do that is we start with the Zypher process, which is this structure over here, and we also find the pubic symphysis, which is this structure down below. So if we make a line connecting the two, we get our vertical plane. And now we have a right and a left. For our horizontal plane, this is called the horizontal transumbilical plane. So what this is doing is dissecting the abdomen into an upper and a lower section by going straight through the umbilicus at the level of the intervertebral disc L3 to L4. So unfortunately in this picture we don't have our umbilicus, but it would be at around this level. And so now we have up and down, so we can just make this right upper, left upper, right lower, and then left lower. As I mentioned before, this comes in handy in several clinical scenarios. For example, if you want to differentiate between an appendicitis, which is inflammation of your appendix, and a cholecystitis, which is an inflammation of your gallbladder, then being able to differentiate between right upper quadrant and right lower quadrant pain becomes very relevant. Your gallbladder is this structure right here. It's on the right upper quadrant. And your appendix, this structure right here, is on the right lower quadrant. And to add on to this, if you think of diverticulitis, which is an inflammation and infection of some small pouches that can form in your intestines, this usually presents in the left lower quadrant. So knowing where your pain is or which quadrant your pain is in comes in very handy in medicine and in your daily life as well. So now let's move on to the 9-region pattern, which is a little more specific. So let's zoom in into our right picture now. We're doing the 9-region pattern. So in order to get 9 regions, we need to have 4 planes, 2 horizontal and 2 vertical. And let's start with the vertical ones. The 2 vertical planes are basically continuations of the mid-clavicular planes. Unfortunately, in this picture, we don't have clavicles, but we can draw them a bit. So we have our collarbones right here. So all you want to do is find that midway point around your clavicles and connect it to the midway point between the pubic symphysis, which is that structure we found before, and each respective ASIS, which is just that frontal spine of this pelvic bone. So let's go ahead and do that. So we'll be kind of around here and around here. And so these are our planes. Okay, so those are the vertical ones. So let's move on to the horizontal ones. We have a superior horizontal plane, which is also called a subcostal plane, which just goes inferior to the costal margin. So if you find the end of your rib cage, you just kind of connect the two, and that's our superior horizontal plane. And then our inferior horizontal plane is also called the intertubercular plane. And so this intertubercular plane is connecting the tubercles of the iliac crests. So if we go back to the ASIS, the structure right here, we have that iliac bone. And if you go 5 centimeters posterior to that ASIS, you can feel the tubercle of the iliac crest. And so all you're doing is connecting these two, and then we have our second horizontal plane. So now we have our 9 regions. Remember that the abdomen is bound superiorly by the diaphragm, so we can just disregard that. Each of these regions has a certain name. So this is our right, this is our left. Starting with the superior lateral regions, these two, this is what's called the hypochondrium. So HC, and this is right and left. And it's called the hypochondrium because hypo, as in low, and chondrium, as in cartilage. It's right inferior to that cartilage in your ribs. Moving down, we have the flanks, so the right and left flank. And this is usually where patients experience the pain of kidney stones. So let's continue moving down. Now we have the groin. So the right and left groin, also called the inguinal regions. Moving into the center, so we'll start again top to bottom. The top one is the epigastric region, and that's because it's right above the stomach. So that's the epigastric region, and this is usually where patients experience pains like heartburn. The center one is the umbilical region, where your umbilicus is, more simply another word for belly button. And then the last region is the pubic region. And if you're having a little trouble remembering that, just think that it's closest to that structure we talked about, the pubic symphysis, which is connecting the pubic bones. And so those are the 2 most common ways in which the abdomen is divided. So I really want to thank you for watching this video. I hope you really liked it and found it useful. If you got this far, please give this video a like. Comment below if you have any questions or if you want us to make any videos of any different topics. And lastly, don't forget to subscribe so you don't miss any future videos.